it's Dr. David Greene, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy, which is obviously a tremendously huge topic, but for the next few minutes I'm just going to give some overall concepts so that you can get an idea of what stem cell therapy is and what it might potentially be able to do for you and your loved ones. Okay? So when you think about stem cell therapy, it's very different than the treatments that, for the most part, we've had in place in medicine for the last 50 or 100 years even. When you look at medications that people receive, the drugs that they're given, even the surgeries that are being offered, they really aren't made to address the root problem, the root cause of the diseases that people suffer from. Okay? So that's where stem cell therapy is different, and that's why it's called regenerative medicine. Because the word regenerative refers to the ability to help repair and restore tissues that have been damaged. It may be kidney tissue, cartilage, lung. So when we talk about stem cell therapy, we're talking about biologics that come from one of two potential options. One is called autologous. The word auto means self. So that means tissue that comes from the patient, him or herself. It may be from a person's bone marrow, which is most prominent in the pelvis. We have bone marrow in every bone, but most commonly it's taken from the pelvis. Or a person's fat tissue, which is called adipose. And when that is taken, it's either from the belly area or the buttock. So autologous stem cell therapy is very popular around the world, and we offer it at some of our centers, not many. Why, you may ask? Because, for instance, with bone marrow stem cell therapy, as a person ages, the amount of stem cells available in one's bone marrow drops precipitously after the age of about 45. So where finding a stem cell in your bone marrow is almost like finding a needle in a haystack, okay? So we don't have any centers that offer bone marrow stem cell therapy. Plus, it's actually very painful to get a big fat needle stuck into your pelvic area, and that pain can persist for months afterwards. So adipose tissue does have a significant amount of stem cells in it. There's a couple issues. One is a lot of the stem cells that we all have in our bodies are as old as we are, and they tend to get pretty lazy as we get older. So they're just not as active as they are from umbilical cord tissue. So umbilical cord tissue, amniotic fluid, those fall into what's called allogeneic tissue. So allogeneic tissue involves tissue that's been donated and comes from somebody else. So amniotic fluid's been used since like the 1930s. Umbilical cord tissue has been used in regenerative medicine for the last 20 years and has gotten extremely popular over the last 5, 6, 7 years. We use it frequently for a lot of reasons. One is nobody rejects umbilical cord tissue that comes from a reputable lab like ours. Another is that it has a tremendous amount of mesenchymal stem cells in the tissue. Mesenchymal stem cells are very active, they're very pure and potent, and they give great results. Another reason that we use those is there's no ethical issues at all with harvesting them, meaning there's no harm to baby or mother. The tissue comes after a scheduled C-section in a very ethical process. It's FDA regulated, the mother is consented and screened very heavily, okay? So it's a fantastic opportunity to use these birth tissues, which are otherwise normally discarded. Now let's talk about the types of stem cells that are available from the various tissues. And I'll start with the ones that we don't use, all right? We don't use embryonic stem cells in any clinical treatments at any of our centers around the world. Why? Well, there's a few reasons. The first includes an ethical issue. embryonic stem cells come from aborted fetuses, okay? And when you use that, there's ethical issues involved with it. The other way they can be received and used is from leftover embryos after an in vitro fertilization. All right, there's also potentially ethical issues with that too. If you disregard those ethical issues entirely, embryonic stem cells are still not suitable for use in a clinical setting. Embryonic stem cells can cause rejection issues and tumors. So right now, in these studies, there's not that many of them in humans. If you're going to use an embryonic stem cell in an actual patient, you have to use immunosuppressive drugs first. Otherwise, a patient's going to immediately reject an embryonic stem cell. Okay? So for a lot of reasons, we don't use them at all. We never have. Now, another one is called induced pluripotent stem cells. The theory with iPSCs, is what they're called, is amazing. And I think they have a very bright future. So what you want is you want what's called a pluripotent stem cell. For instance, embryonic stem cells are pluripotent stem cells. Pluripotent is a term that means those cells can turn into any type of cell in the body that's needed. And that's fantastic, right? It could be kidney, it could be pancreas, it could be a lymphocyte, a red blood cell. That's what you really want. But you want to eliminate the ethical issues, right? But you still want a pluripotent stem cell. Induced pluripotent stem cells are ones that come from any existing adult cell type. So as an example, you can take an epithelial cell from a human adult and induce it to go back to being a pluripotent stem cell. You take a differentiated cell, you induce it by removing the nucleus and replacing that, and then you can go back to being pluripotent. Sounds great, and the theory is that when you have a specialized cell, let's say it's an epithelial cell in the skin, that cell still has all the other genetic DNA in it. It's just been hidden and it's secret. So if you induce it to open back up all of those potential, and you take it back, you have a pluripotent cell. In theory, it's great. In reality, though, we're just not there yet clinically. You still have problems with rejection, and you still have some problems with potential tumor formation. So induced pluripotent stem cells are going to be reality down the road. We just have some issues to figure out first. So what we have available to use clinically is not a pluripotent stem cell that can turn into any cell in the body. We have a level down from that called multipotent stem cells. And those stem cells are still very good. They involve one of the germ cell lines, and they can turn into a bunch of different cell types, but not everything. Okay? So we can still use them clinically and get great results for things like kidney disease, lung disease, arthritis. There's a whole slew of conditions that we treat at our centers around the world. There's over 70 of them. So let's talk for a second about the different types of multipotent stem cells. There's really two main types in the tissues, the umbilical cord tissue. One is hematopoietic stem cells. Hematopoietic stem cells can be very helpful, but they have a very limited ability as to what they can turn into. They can only go down the myeloid cell line, which is really just red blood cells, white blood cells, blood type cells, okay? And that's pretty limited. They can't turn into a cartilage cell. They can't turn into kidney or lung or any type of organ tissue. For those, we need the second type, which is called mesenchymal or mesenchymal stem cells. And those are very, very prevalent in umbilical cord tissue. They are very active. They are very proliferative, which means they can replicate and replicate and replicate. There are two main traits of stem cells that you need to understand. One is that stem cells can replicate themselves, and the other is that they can differentiate into a specific cell type. So, for instance, a mesenchymal stem cell that comes from umbilical cord tissue can replicate itself, kind of like a Xerox machine, over and over and over. Now, at a certain point, it's going to decide to become either a cartilage cell or a kidney cell or something very specific, okay? And that's a one-way road. It doesn't replicate anymore after it turns into a specific cell type, all right? How does it know what to become? So for instance, if you give stem cells into somebody's knee, could those stem cells become a lung cell or a liver cell? That wouldn't be very helpful, right? Why would you need a lung cell in your knee, okay? Well, here's how it works. When you give stem cells into a specific area, they will react to the environment in which they are placed. So a mesenchymal stem cell from umbilical cord tissue, if we inject it into your knee, it's going to speak and listen to the environment around it, and it can compel the stem cells in a person's body to turn into cartilage or ligament, or there's fat tissue in your knee as well. So it listens and reacts to the environment that it's in. So that's very helpful. Otherwise, you'd end up with a lot of cells that you just can't use in those areas. So when it comes to the types of stem cells that we're using, what conditions can be treated with stem cell therapy? So we've already established that the cells that we use come from an ethical source. They are processed at an FDA-approved lab in the United States. The stem cells are very, very plentiful in umbilical cord tissue. They do not get rejected by the human body. So people ask us all the time, do I need to get cross-matched or cross-typed for blood type or things like that? The answer is no. Not with umbilical cord or any of the birth tissues. Why? Because the stem cells and other regenerative elements that are in these birth tissues don't have what's called HLA-2 markers. If you're going to reject cells, typically what your body does is they recognize the HLA-2 markers as foreign, and they're going to mount a huge rejection reaction against those. Those don't exist in the birth tissues. They're too naive to have developed those yet. So nobody rejects the tissue, which is fantastic. You don't have to undergo all that testing or immunosuppression, all right? So what can they be used to treat? Well, over the last 20 years, there's been so much research done on looking at stem cell therapy for everything from orthopedic conditions, such as sports injury, arthritis, cartilage defects, things like tendinitis, everything with bone and joint. And the most research has been done in that category, and the results are absolutely fantastic. At our centers, the results for the musculoskeletal category, the orthopedic, is about 90% plus effective. Another category that they work really well in is called autoimmune conditions. So autoimmune conditions are kind of a big bucket of conditions. Everything from rheumatoid arthritis to psoriasis to lupus to gout. You know, even diabetes is an autoimmune condition. Some people put things like MS into the autoimmune bucket. But what you'll find is that stem cells work really well at modulating the immune system. They can really stop the body from fighting against itself. It can tamp down harmful cytokines, interleukins, growth factors, and ramp up the helpful ones. Okay, so autoimmune conditions they respond fantastic to stem cell therapy. Another category that we see a lot of patients in is the neurologic category. And this can range from kid disorders such as autism, cerebral palsy, can work great for, and then as we move into the adults, stroke, post-stroke, as well as Alzheimer's disease and other forms of dementia, anything involving the central nervous system, such as ALS, and we do specific videos regarding those conditions, and you can look on our website to see more of that. Another category where they work really well would be organ failure. So we're talking about either liver, kidney, lung, pancreas, which is usually diabetes, but it could be something for more like pancreatitis. Works well for that as well. Heart failure, seen fantastic results, and we have so much peer-reviewed literature now regarding these solid or hollow organ systems that it's fantastic to see those types of results with very, very few side effects. Another thing that stem cell therapy works really well for is erectile dysfunction. Erectile dysfunction is really, really common in men as they get to the age of 40 and up. It gets to about 60% over the age of 60 have some sort of erectile dysfunction. It goes up to 80% over the age of 70. So it works really well for those types of issues, and it increases blood flow. So when it increases blood flow, a lot of times it helps a lot with resolving the ED situation. COPD, as well as pulmonary fibrosis and COVID, we see great results with stem cell therapy. One of the ways that stem cells work with COVID is to tamp down the cytokine storm, and that goes back to immune modulation, okay? So these initial studies looking at people who got stem cell therapy with COVID while on an intubator with intubation, with those who did it, there's a pretty high rate of death in those who did not get stem cell therapy. And we're also seeing really good results at our international centers for post-COVID lung issues, which is usually some sort of pulmonary fibrosis. All right, so in Pakistan we have several locations. We have our headquarters in Islamabad, we have a great location in Lahore, as well as one in Faisalabad, and one upcoming in Karachi. Our phone number to set up your free consultation to see if stem cell therapy could help you or a loved one is 051-889-6711. Our location in Islamabad is in the Jangia Multiplex near the Golra Moor in H13, Islamabad. Thank you very much for watching. We look forward to hearing from you.